that was an experience. I would say that was a chilling experience. Because can you imagine the bubbly mokola with no human being? All you could see and experience were the structures and a few rodents having their own, you know. Yeah. And then our journey to the tertiary institutions. I particularly remember our journey to the railway place there, CMB, that place, you know. Very, very sobering. Very, very sobering. People who were practically homeless, who had been locked down but functionally locked out because you were supposed to be locked down in your homes, but they had no homes to go to. And a lot of them were watchmen, self-appointed watchmen for the wares of some of the traders, you know, and had no food to eat because, one, they didn't have the livelihood, they didn't have what it takes to get money, and even if they had the money, there was no food to buy. And so it was a very, I almost broke down that day. And that was when we organized with Rigwell Solutions, and Rigwell took that responsibility to also do the intervention by providing food to a number of these communities.
Okay, so we'll give you the first part of the documentary and then we'll come back and look at the second part.
When Ghana recorded its first cases of the novel coronavirus, news reporting on the pandemic took a different angle. The storytelling changed from just international news channels to local news outlets. As community media houses, Citi TV and Citi FM had to reposition themselves to tell the COVID-19 story in a more analytical, educative, informative manner with regular updates.
So over 1,300 sprayers are supposed to take part in today's disinfection exercise across major markets in the Greater Accra region. Speaking of about 137 markets, and we're currently on the premises.
I think what COVID did was to open our eyes to a lot of issues confronting society. And so every day within the COVID period was an opportunity for us to learn new things about ourselves. There may have been new things that have existed, but we really had not averted our minds to it. So given what we were faced with, we normally would look at our resources and then see what we can do as an organization and as a team. And so that's what first prompted us into action. And most of the actions we undertook, again, would be as a result of the new knowledge that we received as associated with the COVID. So that's why we did what we did. And we thought that we also owed it to our community to contribute our quota, which we did to our abilities. For some of the interventions, we had companies calling to contribute money, but we refused, directing them to also commit their resources to their own communities and within their own circles. So we were not expecting any resources from any quarters. We did what we did based on our own motivation and what we thought we owed to our community. And that's what we did.
This was the beginning of a series of activities, programs and interventions by the stations to contribute to the national fight against the coronavirus pandemic.
The first one had to do with the fumigation exercise that we undertook. So first I saw, watching television, international TV channels, I saw the Asian countries, embarking on mass fumigations in their public spaces. And we thought that why not Ghana? At that time, people were still battling over the theories of whether fumigation was necessary or not. But we said, why not? So we contacted Zoom Lion Company, told them that, look, we wanted to do this. We don't have the money, but we could partner and do. And Mr. Japan was glad to help. And so we came together with Zoom Lion, first and foremost, to go into our markets. So we had the Makola markets, and then later the other markets followed in Accra. After that, again, we thought that there was an opportunity to look at fumigating tertiary institutions. So that's, again, the next stop. We went to tertiary education. The plan initially was to do tertiary institutions in Accra, but we ended up doing over 22 tertiary institutions across the country, again with the help and support of Zoom Lion. Now, as I said, this was based on our knowledge of how the COVID would spread, and whether it was airborne, whether it's rested on surfaces and open spaces. Again, talking about the health workers, we saw again that, look, these are people who are exposed because they are committed to doing the work that they've been called to do, providing health and support. And so we organized this virtual concert, we call it dubbed Rally Round the Flag, in recognition of their good effort and the services that they were providing to the nation. So we called them, we actually called them out and celebrated them as health workers through the concert that we did called Rally Round the Flag.
At the outset of the pandemic, the scientific community and the World Health Organization, WHO, on 12 January 2020, recommended two main criteria for declaring someone who was tested positive as having recovered from the disease. The first is that you no longer have symptoms, and the second is that you're no longer capable of infecting others. Initially, the scientific thinking was that as long as you continue to test positive, you're capable of infecting others. Hence the requirement for the two consecutive...
One element key to the fight against the pandemic is information dissemination. Citi TV and Citi FM ensured that every detailed information from government was shared with the public. This called for dedicated airtime to broadcast live all presidential addresses, as well as a series of press briefings by the Ministry of Information from day one. There was a deliberate realignment of news programming to bring updates to the public through a specially designed coverage of the pandemic, which aired daily at 3 p.m.
Good afternoon. You're welcome to our special COVID-19 coverage. This is Citi TV. If you're listening to us on radio, you're on Citi 97.3 FM. My name is Abnanya Meche-Ampedu, and this afternoon, as always, we are looking at the global pandemic, that's COVID-19, the issues arising, especially in Ghana, our numbers, how it is affecting people, the ban on public gatherings, among other issues that are coming up. So do stay with us. We have more for you.
115 was from the people who were mandatorily quarantined. So 500 and something general surveillance, 1,013 enhanced contact tracing. But look at the tests that are producing these cases. The routine surveillance, 543. The tests conducted to get that figure was 22,054. So 22,000 tests, 543 are positive.
Means that 68,000 individuals have been tested. And I'm just going to read the quotes.
We'll play the video in a bit.
Yes, as well. But I'm
Okay.
just reading the quotes that we have here. It says that each respiratory sample is accompanied by a case investigation form. People refuse to accept a sample if it does not come with a case investigation form because they need to understand where that particular individual came from.
So based on the information we've seen, it points to the fact that we are collecting the data, even the number of contact traced in a day, on the regional level, at the district level, they are collecting all that information, which helps us to make decisions in managing the case, in resource allocation and whatnot.
Because the world has to move on. We don't know how long this is going to take. It could take about 2 years. You never know. So the world is not going to lock down for 2 years. So we have to just find the ways and live with the protocol. So it's about living cautiously. You want to have your freedom, but still you exercise some caution without freedom because the disease is not gone yet. We know that a vaccine is a long-term solution.
We're doing something called the double negative testing. You test the patient for 2 weeks. If they come out negative, you test them again before you release them. But now we've had the WHO protocol for releasing positive patients, and our numbers have gone up drastically from 4,000 to...
So the COVID-19 pandemic is new to all of us. I mean, nobody saw it coming. And of course, there was no written thing to guide you in whatever you did, wherever you found yourself, including media and for that matter news. So when the pandemic struck us, of course, it started with China, Wuhan. I mean, at a point we were not sure it's going to get you, and then boom, it was in our face. The first cases were reported. I remember very well the Minister of Health, together with the Information Ministry, announced it on a Thursday evening, saying that we had 2 cases here in Ghana, one a foreigner, one a Ghanaian. And at that point, we knew the time had come for us to now localize the news. Of course, prior to that, it was an international news. So how do you cover a pandemic, which is one that is contagious, which is one you can pick easily, which knows no bounds, which doesn't pick, oh, you're a news person, so it's not getting to you, you're a politician, it's not getting to you. And then now thinking of how to mobilize the news team to go out there to bring the story to viewers and listeners and all that. It was a very difficult and challenging task because if you remember at the point when it started, even the medical bit, people were not sure in terms of the levels and how you could pick it. What we did as a station, for example, was the first thing to think about was the safety of our journalists. At the same time, giving accurate news on the virus, so health.
So that's just a teaser of the documentary. We'll be airing that full documentary at 6 p.m. today. So that's in a few, an hour and a half or so, we'll be airing that documentary, or exactly 1 hour. So stay tuned to that. But let me take a few messages for you, Samen. So you guys, this one says, Vivian, you and your boss, Samen, should stop saying that you're ending this program saying, okay, what can we do to make you change your mind? Let's talk. This is from Pastor Alex Brown. He's a dentist. A lot of people protesting the ending part, but we have to wrap up and move away to other programs. But sometimes your final thoughts on this, having to do this program, interventions and all that. And then
we've done what we have to do. We rose up to the occasion within our restricted budget and revenue, or no revenue at all coming in. So we have our backs against the wall. And we are saying that we also need to harness our resources in pursuit of other programs which are essential to our communities and our societies. There's registration going on leading up to elections, and I'm not saying that COVID is not important, but I'm just saying that we need to deploy our space for other programs, and that's what we have to do. As a, I don't think that you'll be happy to hear that there's voting going on in your neighborhood, and we're not talking about it because we have COVID programs that you've been listening to for the last 3.5 months. There are other things, but we will still be covering COVID extensively. At all times, we will cover COVID. But what I will end by saying is that I still appeal to the government to meet us halfway as media. I don't know the formula they will use. And I'm not also asking that they should hand money to us. I am saying that they should look out for media houses that have obeyed their statutory payments over the period, or who have a habit of paying their taxes, and meet them halfway. At least some percentage tax break, or let's not pay the tax at all. Because feeding of staff, buying fuel, electricity bill, of course, until the president brought the intervention, it's all come to add to our expenditure. And no wonder some media houses have come to,
a bit of a halt in a way.
A number of media houses have collapsed within this period. And I don't blame them, except for the media houses where people were volunteering to work for free. Even that, you still have running costs. And so there's a bigger problem that the government is not looking at. And I think that if they haven't been told, I am saying it, and I'm saying it loud and louder, that we need the attention of the government, that the media has to be, as we say, sort us out.
It was only come inside.
Not solid, but this one for sort us out big time.
We have to go. Thank you very much, guys. Someone Mensah is the managing director of Citi FM and Citi TV. Ebenezer Efenyi is the head of the Citi Business News Desk here at Citi FM and Citi TV. So that's it for you guys, both listening and watching us. This is the end of the COVID-19 special program. Like we said from the beginning of the show, we still have a lot of attention on the COVID-19 pandemic. We'll be giving you the information as and when it comes in on our news bulletins, on other programs, other platforms here on Citi FM, Citi TV, as well as citinewsroom.com. And our documentary that we promised you, we did a bit of 50 minutes. The full one, much more exciting things, you see, chilling things, will air at 6 o'clock this evening on this station, Citi TV. So that's just in an hour's time, so don't go away. My name is Vivian Kai Loko. Bye-bye from us.